A postmenopausal female client presents to the client after being newly diagnosed with osteoporosis. The client is here to discuss with the nurse what type of lifestyle modifications she will need to treat the disease. Which of the following should the nurse include when educating the client? A. Start a low carbohydrate high protein diet. B. Quit smoking. C. Lose 10 pounds. D. Drink 1 glass of wine with dinner. E. Engage in low impact exercises. The answer is B. Quit smoking. Smoking and alcohol ingestion are risk factors for developing osteopenia or osteoporosis. These activities should be discontinued to help prevent against bone loss. Diet and exercise are important factors, but losing 10 pounds or low impact exercise will not increase bone mass. The nurse cares for a 16-year-old patient in the emergency department. He has returned to the hospital after having a fiberglass cast applied to his right ulna from a fracture the day before. Which of the following manifestations in the patient should most concern the nurse? A. Warm fingers and palm in the right hand. B. Capillary refill of 3 seconds in the right fingertips. C. Itching under the cast. D. Severe pain in the right arm. E. Pain in the right shoulder. The answer is D. Severe pain in the right arm. The nurse should be aware of potential complications of cast placement, such as compartment syndrome, which can cause nervous, vascular, and muscle damage. Signs and symptoms include tingling distal to the cast placement, severe pain in the casted region, swelling in the cast and distal to the casted region, pallor in the affected region, and muscle weakness. These signs and symptoms would indicate immediate cast removal to prevent further damage to the tissue. Itching under the cast is common and expected, and pain in supporting shoulder of the arm can occur due to the increased weight and positioning of the cast. 3 seconds for capillary refill is within normal limits. Extended time for capillary refill in the distal region would be concerning. Warmth in the hand and fingers distal for the casted region would indicate normal circulation as well, but congestion and swelling in the extremity would be worrisome. Which of the following is described as a malformation resulting in narrowing or absence of a portion of the intestine? A. Malrotation. B. Intestinal atresia. C. Volvulus. D. Hirschsprung's disease. The answer is B. Intestinal atresia. Intestinal atresia is a malformation resulting in narrowing or absence of a portion of the intestine. Duodenal atresia is the most common type, followed by ileoatresia. Hirschsprung's disease is an issue of innervation in the large intestine that can result in narrowing due to contraction, but there is no structural malformation in the bowel itself. Malrotation and volvulus are often seen together when a part of the intestine does not anchor or turn correctly during formation, malrotation, and then becomes twisted around itself, volvulus, resulting in constriction and loss of function. What is the triad of symptoms often seen with intussusception? A. Bloody vomit, black stool, and low back pain. B. Colicky abdominal pain, bilious vomit, and red currant jelly stool. C. Constipation, projectile vomiting, jaundice. D. Coffee ground emesis, bloating, and diarrhea. The answer is B. Colicky abdominal pain, bilious vomit, and red currant jelly stool. Intussusception occurs when part of the intestine folds into another section of intestine, much like a telescope. This results in sharp, crampy, or colicky abdominal pain, vomit of bile, and bloody red currant jelly stool. Black stool and coffee ground emesis are both symptoms of upper gastrointestinal bleeding, stomach, generally, while projectile vomiting may be associated with pyloric stenosis. What is the most common location for diverticulitis? A. Ascending colon. B. Transverse colon. C. Splenic flexure. D. Sigmoid colon. The answer is D. Sigmoid colon. The most common location for diverticulitis is the sigmoid colon. This area generally has increased pressure as compared to the rest of the large intestine and is especially vulnerable to weakness in the muscle layers of the colon wall.